Hi, I'm Dr. Carr, and this video will help you know what you should do to use the breath testing kit that you're going to receive so that you give us a good set of samples. When you open up the box, you'll see it contains a total of 10 tubes, and you'll have to cut those bags open. And these tubes have vacuum in them so that they'll suck an air sample when you're giving us the sample, as you'll see in a moment. There are also 2 bubble wrap bags that you'll put the tubes into before you mail it back to us. There's also a little container of lactulose, and at the right time you'll be mixing that in some water and drinking it, but not until you give an initial first breath sample before you drink the lactulose. This is the way that the Easy Sampler kit will come in a bag. Notice that the bag says caution needle inside. There's a place where you should not put your finger because inside there's a sharp needle covered with some rubber that punctures the tube to get the breath sample. There are 10 labels for the 10 tubes. Our test, which is a 2-hour test every 15 minutes, will only use up 9 tubes, so you'll have 1 extra, and you can send it back to us with the others. There will be this instruction sheet, which I have customized so that it tells you exactly what to do for our test. A patient breath testing questionnaire that I'd ask you to fill out as best you can and send it back with the kit. And also a copy of the preparation guidelines. And this is also on the website, and you may have received this separately as well. When you're ready to begin the test, you will have the lactulose and 8 ounces of water in a cup ready, but remember you're going to get the first breath sample for tube number 1, which we call the baseline breath sample, before you drink the water with lactulose in it. So I suggest you collect this breath sample first because you've got time. There's no timer yet. Mix the lactulose in the water and then get ready to drink it when you've got a timer ready to help you measure 15-minute intervals. So again, you're going to collect a breath sample for tube number 1 first before you mix the lactulose in the water, drink it, and at that point you start using the timer. And tubes 2 through 9 will be 15 minutes apart, giving you a full 2 hours of testing. Now I'm going to show you how to use this Easy Sampler device to get each of the breath samples. You'll see that there's a mouthpiece with a bag connected to it, and the bag shows you when you're exhaling. There are holes in the bag so that your breath will move through it. Connected to the side of the mouthpiece is the place where the tube will go. That's where the sharp needle is covered with rubber. Don't put your finger in there. But that's where you'll be putting the tube, and at the right time, which I'll show you in a moment, while you're in the middle of exhaling, you'll push in on the tube into the needle so that the breath sample gets taken up. You'll keep exhaling for another 2 seconds, and then while you're still exhaling, pull the tube out. So you'll see me take in a breath, put my mouth on the mouthpiece, I'll have the tube in here ready, I'll start exhaling. You'll see that I'm mentally counting 1 1,000, 2 1,000, then I'll press this in. You'll see me mentally counting another 1 1,000, 2 1,000, and then I pull the tube out while I'm still exhaling. So let me show you how that looks. I'll take a breath in. Nice and easy. Let me repeat that. I'll be taking a breath in, put it in my mouth on the mouthpiece with the tube ready but not pushed into the needle yet. I'll start exhaling. I'll count 2 seconds, then push the tube into the needle while I'm still exhaling, count for another 2 seconds, pull the tube away. And that's what we'll do each time. Let me show you that again. breath in. It's that easy. Each time you can scrunch up the bag so that you'll hear it and see it inflate each time, showing you that you're exhaling well. And with each of these tubes, either you'll have put the labels toward the lower end of the tube before you start, which I recommend, and then have them all lined up, number 1 through 9. Or if you prefer, you could use the labels, put your name and the tube number. That's all we need, name and tube number, and the time that you start and the date. Put a label on each tube, and after you collect each sample, you could finish putting the tube number on it. But remember, your very first sample will be before you drink that lactulose. So I suggest you have the 8 ounces of water in a cup ready, have the little tub of lactulose ready. Take your time to do a good job getting your first baseline sample. Then mix the lactulose in the water, have your timer ready, because it's only when you drink the water with lactulose that's when the time starts. So as soon as you finish drinking the water and lactulose, you'll turn on the timer on your phone or with a kitchen timer set for 15 minutes. And then you've got 15 minutes before you do sample number 2, and then you keep doing that. Finish your labeling so that each tube is correctly labeled with the correct number. Put the start time and date just so we know when you did it. And then over the 2 hours after you drink the lactulose, you'll collect 8 samples in tubes 2 through 9 for 2 hours of sampling. So you're all set. Once that is all done, you will put the tubes in those bubble wrap bags back in the box. Put the form, the questionnaire form, that's the important one that we need, back in the box also. There'll be a mailing label in the box. You'll close the box, put the mailing label on the top, covering any other label that might have been there. Get a piece of clear plastic package wrapping tape, would be the best thing to use, to seal that edge where you close the box, and then it's ready to mail back to me. Thanks very much, and good luck.